صباح الخير طلابنا الأعزاء. اليوم راح نتحدث عن المحاضرة الأولى لطلبة كلية طب الأسنان الجامعة الوطنية. والمحاضرة الأولى راح تتحدث عن blood transfusion and alternative therapies. Blood transfusion is substantially utilized and has a significant association risk and including of the following. Including of transfusion reaction, transmission of pathogen, and immune suppression. The accepted transfusion trigger in euvolemic patient is about 70 grams per deciliter. This is for healthy individual. And about 8 to 9 grams per deciliter for patient with comorbidity association with decreased cardiopulmonary reserve. Blood transfusion is an independent predictor for multiple organ failure, MOF, and systemic inflammatory response syndrome, and also increase infection, mortality in patients with severe injuries and undergoing complex surgical procedures. Transfusion is only the amount of the blood that maximizes immediate survival and minimizes the late inflammatory complications. This is the goal of resuscitation. Trauma or a traumatic patient and other patient in hemorrhagic shock should be transfused based upon blood pressure, pulse, and other measurements of decreased perfusion rather than relying upon laboratory values. Blood vicious cycle, a rate of death including bleeding, hypothermia, acidosis. This lead to blood vicious cycle of hemorrhage and resuscitation, hemodilation, and coagulopathy and continual bleeding. The strategy that should be undertaken is damage control strategies. Control immediately life-threatening injuries and hemorrhage and wait until normal physiology has been restored in the ICU prior to definitive repair of injuries have been adopted to avoid the blood vicious cycle. من يجيك المريض انت عنده مثلا فقدان لبلد هواي، انت اهم شيء هسه تنقذ حياته من خلال ABC. تكمل بحيث يصير البلد برشر مالته اوكي، يلا بعدين تنقله الى مكان العمليات. Blood transfusion is integral to success of advanced surgical procedure on the heart transplantation, joint replacement, major cancer resection, and major injury. When the patient loses blood either from injury or an operation, the blood transfusion has the obvious benefit of restoring oxygen carrying capacity to maintain the metabolic demand of organs and tissue. On the other hand, there are definite risks and consequences of infusion of a blood product, and these include the following: transfusion reaction, transmission of pathogen, and also immune suppression. So, as with any therapy, it is important to establish the risk-benefit profile for the various clinical situation in which blood transfusion is considered during the care of surgical patients. Now, the potential benefit of blood transfusion. It is obvious that blood loss leads to lack of oxygen carrying capacity, decreased tissue perfusion, ultimate organ failure and death if allowed to procedure below the critical threshold. Threshold is different and depends on circumstances. And a sudden loss of blood, as occurs after major vascular injury, can result in profound hemorrhagic shock and sudden death if control of bleeding and volume restoration do not occur rapidly. The gradual loss of blood, what will happen? As usual occur during elective surgical procedure or operation, continuous intravascular volume repletion lead to eovolemic anemia rather than profound hemorrhagic shock. Under condition of eovolemic anemia, it has been established that the lower threshold for hemoglobin concentration below which organ function cannot be maintained is in the neighborhood of about 5 to 6 grams per deciliter. This threshold may be somewhat higher in a patient that have underlying decrease in the physiological reserve, such as patient with coronary artery disease or patient with a chronic obstructive disease. Sign and symptom of decreased perfusion are rather than